Well, hey everybody, this is Robert and welcome to Outbreak News TV. And today's big news story is the COVID situation in Brazil. And as you can see on the screen, Brazil has passed the 1 million case mark. So they're right up there with the U.S. as the two countries that have surpassed 1 million total cases to date. Now, according to the CNN report, it says Brazil has now reported more than 1 million confirmed cases of coronavirus and about 49,000 fatalities, marking a grim milestone for the South American country. Today, Brazil reported 54,771 new cases, a record daily spike that put the total cases to over 1,032,913. The COVID-19 pandemic is quickly spreading with no sign of slowing down as major cities lift social distancing measures and begin reopening restaurants, shops, and other non-essential businesses. Many experts believe the number of cases could surpass the United States and that Brazil may soon become the country worst hit by the virus. And we have seen projections from like the University of Washington saying that Brazil will surpass the United States by August, I believe it was. But despite all this news with the increasing cases and fatalities in Brazil, President Jair Bolsonaro continues to downplay the threat by questioning global medical authorities and accusing opponents of trying to discredit his leadership. At first, Brazil seemed impervious to the virus as it spread through countries like China, Italy, and the U.S. Bolsonaro only grudgingly agreed to repatriate Brazilian citizens from the then epicenter Hubei province, reportedly worrying that they would put the rest of the country at risk. The first case was confirmed February 26th, when it was believed to be an isolated case of a man who flew back from Italy to Sao Paulo with the virus. A month later, coronavirus cases in Brazil had already risen to close to 3,000. It was at this time when Bolsonaro first compared the virus to a little flu and falsely implied that Brazilians were immune to the virus. Quote, "Brazilians don't catch anything. They already have the antibodies to keep it from spreading," he said. And he hasn't been much of a fan of social distancing either, or using masks or any of those types of measures. So he's taken a lot of criticism. I saw journalist Glenn Greenwald, who's actually living in Brazil, do an interview saying that, there's talks of a possible military coup in Brazil because of Bolsonaro and his inattentiveness to the pandemic. But anyway, so Brazil has passed that 1 million case threshold. Now, South America as a whole is reporting more and more cases. And behind Brazil is Peru. And Peru is now up to about 250,000 cases as of today. And it says as of June 19th, this is computer translated, Peru has tested about 1.5 million people, and about 250,000 people have tested positive. To date, there are over 10,000 hospitalized patients, of which over 1,100 are in the ICU with mechanical ventilation. Lima, the capital of Peru, continues to be the region with the highest number of infected COVID cases, with 141,000. So well over half are in Lima by itself. And so far, 7,660 people have died in Peru from COVID-19. And this report from Al Jazeera says that Peruvian healthcare workers are protesting against the lack of protective gear as the country faces the worst coronavirus outbreak in South America. Well, I don't know if it's going to be the worst, but it's second right now. And it says healthcare workers in Peru have been protesting against the lack of PPE. Peru has one of the highest rates of coronavirus infections in South America. The government has rushed to test more than 200,000 people, build makeshift hospitals, and fly doctors around the country. But many say it is still not enough to protect those frontline workers. So Peru has their issues, and right now they have the second most cases on the South American continent. But climbing up that ladder rather rapidly is Chile. And from the Chile Ministry of Health, we can go through this chart and we can see that they have now 231,393 cases total, after reporting over 6,000 cases today and over 4,000 fatalities so far. So Chile's numbers are rising pretty quickly also. And the health minister, his name is Enrique Paris, is insisting on the importance of reducing mobility as part of the strategy to reduce the spread of coronavirus and slow its progress. So he's highlighting the role of quarantines as part of the measures aimed at reducing mobility and reiterating his call to the will of the people to contribute to control and prevent dissemination. Quote, "We must insist that reducing mobility is essential to reduce the spread of the virus and obviously to prevent it from advancing. We want to appeal to the will of the people, to the reason that they contribute to this important point that I said, avoid viral spread." So they're talking about, possibly increasing some quarantine measures in Chile, and asking the public to abide by these measures. And let me go ahead and close out with this article about Chile. And this is from Bloomberg. And Chile was doing pretty good at one time. Once a COVID role model, Chile now is among the world's worst. And let's see what this article has to say. So what went wrong in Chile goes to the heart of the debate over lockdowns, which health experts now acknowledge work well for the haves but not for the have-nots. In the end, Chile's virus fight seems to have fallen victim to the same factors that spark crises in other emerging markets: poverty, overcrowding, and a massive off-the-book workforce. Staying home for long periods, the world has learned rather painfully, isn't a real option for many. Quote, "If the government is going to make decisions about a world it doesn't know, then it should include people from that world in the decision-making process," said Diego Pardo, executive president of the Espacio Público think tank. He continues to say, "The problem with this government is that it just surrounds itself with its own people." Like the rest of Latin America, the pandemic arrived in Chile as a wealthy return from the vacations in the U.S. and Europe. And I reported on this on a video a month or two ago. They were calling this in South America the rich person's disease because it was coming into the country from people that could afford to travel to places like the United States, Europe, and elsewhere. When they were forced into lockdown, they did so in generously spaced apartments and country retreats. But by the end of April, the official case count painted the picture of an epidemic under control. And President Sebastián Piñera's administration started laying down the groundwork to reopen offices and shopping malls. But the cases started cropping up at a rate of over 5,000 per day as maids and household workers carried the virus home. The government, struggling to explain the surge, hypothesized that higher testing could be the reason why. But that didn't jibe as more results came back positive. 30% of all tests by the end of May versus 10% in April. And it wasn't long before outrage swept the same streets that exploded in social unrest last year. Anti-government demonstrations in October saw almost a third of the supermarkets in the country vandalized or looted and turned the city center into a war zone of smashed lights, debris, burnt-out buildings, and graffiti. In both cases, the chaos can be traced to discontent among the overlooked poor and a government seen as out of touch with its people. So back to South America and COVID, is considered the rich man's disease, the rich person's disease. It was called that at least a month or two ago, and it appears that that's what they're seeing in Chile also. We saw the same accusations in Brazil several months ago. But anyway, as you can see, South America, just between these three countries, have about 1.5 million cases, and that's not including the rest of South America. But these are the three hardest hit countries. We'll definitely be keeping a very close eye on these countries and others. Colombia, Ecuador, they're also creeping up with cases. And in particular, these three, and Brazil, of course. And we'll be watching the political situation that goes on in Brazil as Bolsonaro continues to face criticism from inside his country and abroad. Anyway, I appreciate you watching. Please go ahead and subscribe to the channel. Comment below. I would love to hear what you have to say. And share this with your friends. That's the best way to get these videos out there. And I really appreciate it. And I'll see you next time on Outbreak News TV.